Hello everyone, so there are a lot of exams on my queue, all from the emergency. Let's grab one and report it all the way from the clinical history to the actual report. So let's go. Let me share my screen with you guys. And we have here a pulmonary arterial angiogram. I'm going to hit download. This is a patient, a male patient, 45 years old. Let's see what it is. I'm downloading the clinical file so we can have an idea why this patient is going through such a specific exam. It says he has suspected pulmonary artery thromboembolism due to a pneumonia that has some kind of odd behavior. Just a few more seconds, we are going to open the exam and look for thrombosis, acute thrombosis. It's done. Let's load the images. Yep, I can readily see there is a consolidation on the middle lobe. Yes, indeed. Right here, a major wedge-shaped cortical consolidation with ground glass opacities on its margins. It could be, yes, it indeed could be a presentation of an acute infection, although we know acute thromboembolism in a otherwise healthy male makes no sense to be suspected of if this patient has clinical features of pneumonia. Pneumonia is much more common, makes much more sense. So this is pre-contrast. This is what the patient has. This is a single area affected by this one consolidation and opacities. Doesn't seem like this is a cancer patient. He's a strong patient. There's quite some subcutaneous fat and large muscles. Looks like a normal, healthy patient that has a acute pulmonary disease on the right. So let's grab a post-contrast arterial phase. Yes, it's arterial. This is the trunk of the pulmonary arteries, pulmonary trunk. And we have the right pulmonary artery and the left pulmonary artery. And as you guys know, pulmonary arterial anatomy is quite easy to grasp because it almost follows pulmonary segmentation. So if you know pulmonary segmentation, you know arterial pulmonary branches and anatomy throughout. So if you guys want a particular video about how to memorize pulmonary segmentation, I have a process, a class. I could make a video. Just leave in the comments below. It will be a pleasure if anyone is interested. So as for this video, let's go. Let's see. The consolidation is right here. It's on the middle lobe. Let's see if we find the middle lobe branch. This is the middle lobe branch. Let me just make this a single window so you guys can see it better. So the middle lobe arterial branch is this one. As you guys see, it's perfectly opacified. There is no thrombosis. So this isn't a pulmonary infarction. This is a consolidation. Let's roll over the images. On the axial view, the original view, the acquisition volume, to see if anything on these bright spots, which are sectional images of the pulmonary branches, have any signs of filling defects. Let's go over the inferior lobe of the left lung, lingularis branches, and superior lobes seem fine. Middle lobe seems perfect. Lower left lobe also is okay. I'm already satisfied with this case. I know there is no signs of thrombosis, but as we are recording and talking about it, so let's make it through and look for thrombosis on MPR reconstructions. So this is a sagittal view. Sagittal views help us a lot. So we have here the pulmonary trunk, or truncus in Latin. We have the right pulmonary artery and the left pulmonary artery in its branches, lobar, segmentar and subsegmentar branches. As you guys can see, it's all perfectly filled and opacified. No signs of filling defects that we could call thrombosis, acute thrombosis. This isn't acute thrombosis. This is very nice to look at, because this is a patient who clearly isn't suffering from a severe breathing syndrome. He can hold his breath long enough to make a proper exam, which usually isn't the case with patients that are suffering from acute arterial pulmonary thrombosis. So be aware that this kind of images outside the pulmonary arteries are just mediastinal fat and other vascular structures, and sometimes lymph nodes. This isn't thrombosis, this is normal. Thrombosis must be inside the vessels, not outside on the margin of such vessels. So this is it. We are right here. Just see coronal view. Every plane of the reconstruction gives us features that we can readily see on the other plane. So it's good practice to analyze these images on with all the three planes on the MPR. So it's a normal exam, so I just copy and paste my template, and this is it. I can just hit sign, and it's signed, it's done, and we can go to the next one. So if you guys have enjoyed this video, I'm pretty sure you're gonna enjoy this one right here. Just click here and watch the next one. Thank you so much. Don't forget to hit the like button and subscribe to the channel, and I'll see you on the next video.